नमस्कार. आज मी पार्किन्सोनिझम किंवा पार्किन्सन डिसीज असं म्हणतात, त्यावर आपण क्लिनिक घेणार आहोत. तर मित्र, पार्किन्सन डिसीज इज बिलॉंग्स टू एन एक्स्ट्रा पिरामिडल डिसऑर्डर. आता नॅचरली प्रश्न येणार, एक्स्ट्रा पिरामिडल डिसऑर्डर म्हणजे काय, कोणकोणते पार्ट येतात? एक्स्ट्रा पिरामिडल सिस्टम मध्ये you get globus pallidus, then substantia nigra, putamen, and caudate nucleus. I will repeat: caudate nucleus, putamen, globus pallidus, and substantia nigra. आता ह्या चार मध्ये महत्वाचा ऑर्गन, महत्वाचा पार्ट आपल्या पार्किन्सोनियम डिसीज करता किंवा पार्किन्सन्स डिसीज करता इज सबस्टॅन्शिया नायग्रा. सो Parkinson's disease is a degenerative disorder, and this leads to the depletion of dopaminergic system, and there is a degeneration of the basal ganglia. So these are two things: loss of dopaminergic neurons and degeneration of basal ganglia. Now, one or two important points I would like to mention here, that generally, there is a family history. And second point is very paradoxical. The paradoxical मी ह्यासाठी म्हणतो की it is said that those who do not smoke have double chances of developing Parkinsonism. पण मित्रो, लक्षात घ्या, जर पार्किन्सनिझम होऊ नये म्हणून स्मोकिंग चालू ठेवावी असा अर्थ होत नाही. लक्षात घ्या की स्मोकिंग इज डेफिनेटली हॅझार्डस. आफ्टर नोईंग these 2 points, we come to causes of Parkinson. What are the conditions where you get Parkinson? आणि सगळ्यात महत्वाचं आणि लक्षात ठेवायला फार सोपं ते म्हणजे कॉज नॉट नोन. And cause not known is idiopathic. So idiopathic cases maximum असतात. आणि then second is post encephalitic. तुम्हाला आठवत असेल की मी सेरेबेलर सिंड्रोम मध्ये असं म्हणालो होतो की कॉज ऑफ सेरेबेलर डेफिसिट कॅन बी पोस्ट एन्केफेलिटिक. तर मग काही गोष्टी रिपीट करतो. एन्केफेलिटिक कसं ओळखावं? पेशंट हॅज हाय ग्रेड फीवर, he has convulsions, semi-consciousness, and acute onset. So if these four things are present, then naturally you suspect that this is encephalitis. And then after a sufficient period, after some period, they develop symptoms and signs of Parkinsonism, and therefore it is called as post-encephalitic Parkinsonian syndrome. Next is drug induced, very, very important. And drug induced मध्ये you get prochlorpromazine, chlorpromazine, and metaclopramide. So these are the few drugs which in excess can give rise to a Parkinsonian syndrome. Then coming to the toxic effect of certain drugs in reference to those who are addicts. They can also develop as a toxicity. And then we come to certain conditions like progressive supranuclear paralysis, number one. Number two is multi-system atrophy. हे अंडरग्रॅज्युएट न लक्षात ठेवून तरी सांगेल, पण पोस्ट ग्रॅज्युएट करता जरुरी आहे. I will talk to you later in a short what is it called as. And therefore, after knowing these 6-7 causes, we go to history. Now, history taking मध्ये you will agree that a commonest way of knowing it, whether patient had unconsciousness, patient had convulsions, patient had high grade fever, and which will suggest that probably patient have had a picture like encephalitis. Second thing, as I already told you, that drugs can give rise, and therefore it is necessary to inquire with the patient whether drugs like prochlorpromazine, chlorpromazine, metachlorpropamide, whether patient is taking these drugs for a long time. Now, next, after knowing this, we come to getting the history, whether this particular is, what is the duration. The, the story of Parkinson disease is an insidious onset, and it is after about 70 to 80 years of age. Then there are certain herbal medicines, if they are taken for a long time, can give rise to Parkinson disease. And in herbal medicines, those who use herbal medicines may be knowing that kava, K-A-K-A, kava is one herbal medicine which invariably gives rise to Parkinson. And then comes the turn of Rauwolfia serpentina, which is age-old hypotensive drug. But when I am talking about these causes, remember that the common cause should not be forgotten. And common causes are trauma, hypertension, and cerebrovascular accident. And therefore, the history is not complete unless you inquire about hypertension, cerebrovascular accident. Trauma, cerebrovascular is very easy to understand. And in reference to hypertension, common symptoms are severe headache, more of in the morning, vertigo, and temporary vision is disturbed, and family history. And these are the things by which we know that the patient is hypertensive, to be confirmed by taking blood pressure at least 2 to 3 times before we commit that he or she has hypertension. So, Mitro, after knowing this, then I come to clinical picture of Parkinson disease. Now, clinical picture of Parkinson disease, as I will like to repeat that this disease has insidious onset and age is around 70, 80 years of age. Second important point is mask-like face. This patient has mask-like face, infrequent blinking, mask-like face, and a stare म्हणजे रागाने पाहणे. So when you look at the patient, we find that the patient has a stare, infrequent blinking, and mask-like face. Mask-like म्हणजे expressionless face. आपण कॉलेजमध्ये एकमेकाला म्हणतो, जर काही गोष्ट सांगितली, एखादा विनोद सांगितला आणि तो काहीच प्रतिसाद देत नाही, तर आपण काय म्हणतो त्याला, why are you making mask like face? So mask like face is a sign of Parkinsonism or Parkinson's disease. And मग त्या मुलाने उत्तर दिलं की सूरत ही वैसी है. विनोदाने सांगतोय की mask like expression is an important sign of Parkinson's disease. Then we come to speech. Speech मध्ये बघा, the speech is monotonous and hypophonic. आवाज निघत नाही. That is a feature of Parkinson's disease. After speech, then we come to the gait of the patient, which I am going to show you shortly. The gait of the patient is that patient has a stooped posture, or I will show you the gait. Yes. Now, for gait, what you should do is that patient has a stooped posture, both elbows are flexed, he looks straight, he looks to the ground, and then walks in very short steps, which is called as fascinating gait. So fascinating gait, mask-like face, infrequent blinking, flexion of the both elbows, and stoop posture. And now, therefore, how does he walk? This is how this is called as a shuffling gait. Shuffling gait is a characteristic sign of a Parkinsonism or Parkinson's disease. Friends, I had told you earlier a cerebellar gait. I had also told you about hemiplegic gait. Now there are two, three more gates. Please remember that whatever I will be showing to you is not concerned with Parkinsonism. It is just, by the way, completion of gait abnormalities. I am showing this. If asked for in examination, Parkinsonism has a shuffling gait. Now, other gaits which you should know is spastic gait. Now, the tone is increased, and therefore, when he walks like this, which is a spastic gait. Then, a gait of posterior column inverted. He has no joint position sense, and therefore, what he does, it is called a stumping gait. The stumping gait is like this. This is a stumping gait. Then peripheral nerve lesion, high stability. And next is hysterical gait is a bizarre gait. And that hysterical gait will be very clear when you are examining the patient. But the moment you disappear, the abnormal gait totally disappears. And that is typical of hysterical gait. Last gait we come to is waddling gait. In waddling gait, what happens is that this waddling gait has a lordosis, and then he walks like this, which I will be showing you. In waddling gait, what happens is that a patient has like this lordosis, and this is commonly seen in ladies who have got a twin pregnancy, but bilateral dislocation of it. And one more condition where you may get waddling gait is the Duchenne type of muscular dystrophy. So remember muscular dystrophy and congenital dislocation of hip. So friends, I will repeat that these two, three gaits that I have shown to you are not related to Parkinson's disease or Parkinsonian syndrome. Now I will be showing you. Yes. Now I will be showing you glabular sign. Now in glabular sign, what you have to do? That you have to give hit to the glabella 2, 3 times. Normally, what happens after one or two putting, he stares. There is no, the eye does not close. In Parkinsonism, every time eye closes, and that is called as glabular sign, or it is also called as Meyerson sign. So you can see that after 2, 3 times, there is no blinking. If the blinking continues for a long time, you call it a glabular sign, which is one of the characteristic sign of Parkinson's disease. Now, to continue further about the clinical science, we find that tremor, Parkinsonism has characteristic tremor, and which is resting tremor. Am I true to? This is called as pill rolling movement. Pill rolling movement because the it is like अपन जब कर दो pills. So this movement, shaky movement, and therefore it is also called as paralysis agitans. Agitation is movement, and therefore defect in movement is called as paralytic movement. So coarse tremors, please don't forget. One more important point which the student should remember, that in most of the cases, 90% of the patients, it is unilateral. There is asymmetry. Asymmetry is again a characteristic feature of Parkinson's disease. Then we find that examination of the patient, what are the signs? In examination of the patient, we find that motor system is absolutely normal. Power is good, reflexes are normal, and plantar is extensor. So why do you do motor system examination? It is done to confirm tone. This is third time I am repeating that what is tone? Tone is a sustained contraction in a muscle. And in this condition of Parkinsonism, you get increased tone, and which is called as rigidity. I will talk little later. How do you differentiate between spasticity, rigidity, and paratonia? So this is about motor system examination. Then we find that there can be a handwriting कैसा रहता है a patient's का. This handwriting is micrographia, small size, and then you get a tremor. Therefore, micrographia small is again one of the characteristic of Parkinson's disease. आणि दुसरं बघा, ब्रॅडिकायनेजिया. Bradykinesis, slowness in movement. When we do digital autokinesis, the movement are very slow. So, bradykinesia is a characteristic feature again of Parkinson's disease. Now, once we know all these signs of Parkinsonism, we come to pathology. Now, pathology of Parkinson's disease, there is a degeneration of substantia nigra, there is neuronal loss, and characteristic finding is Levy bodies. Now, Levy bodies are eosinophilic cytoplasmic inclusions in the neurons. Please repeat, I am repeating, eosinophilic cytoplasmic inclusion in neurons. So Levy bodies again is a characteristic feature, and where you find that the patient advanced cases मध्ये there is a mental retardation, and therefore त्याला diseases नाव देतात, and that is called as diffuse Levy disease. So Levy body is an important finding in reference to pathology. Now, the clinical picture is so clear that there is hardly any investigation. This is one of the patients where it is always, in most of the cases, it is a clinical diagnosis. Now, we come to a stage where then how do you treat this? Now, treatment मध्ये drugs are carbidopa and levodopa. This combination will help you in getting the defect of dopaminergic neurons loss to a normal level. Carbidopa and levodopa combination is very good. Then other drugs are amantadine, anticolinin esterase, bromocriptine. So all these names you may not remember, but levodopa and carbidopa, please don't forget. Then next thing in management will be physiotherapy. Physiotherapy again helps in these patients, and you find that these patients in clinical picture have seborrheic dermatitis in addition to seborrheic dermatitis, which postgraduates should remember that anosmia is a feature. Anosmia, early sign. What is anosmia? Anosmia is loss of smell Patient is not able to smell correctly, and that is called as anosmia, which is said to be the early sign in Parkinsonism. So after physiotherapy, now surgery has no much role, and therefore drugs are good. And what is the principle? The principle is low dose, start slow and go slow. Start slow and go slow is a feature of treatment of Parkinsonism. Now, there are certain things where again you get some features of Parkinsonism. And in addition, there are certain signs. फॉर एक्झाम्पल एखादा पेशंट आहे पार्किन्सोनिझम त्याला आहे क्लिअर कट आहे आणि प्लांटर एक्सटेन्स आहे मग त्याला काय म्हणायचं त्याला म्हणायचं Parkinsonism plus syndrome, the signs of Parkinsonism plus pyramidal damage. Now, there are certain conditions, very big jargon syndrome name, so you need not worry for that, in which you get a vertical gaze, you get pyramidal tract damage. And then, if it is congenital, then you get what is called as Kayser-Fleischer ring, which is seen in the eyes, which are again one of the signs of a Parkinson's disease. Now, after knowing this treatment, nowadays there is a deep brain stimulation. A lot of advertisements are coming from various places that deep brain stimulation helps in the recovery of Parkinson's disease. Lastly, we come to differentiation of spasticity, rigidity, and paratonia. Now, I am repeating plasticity. I must have told you that tone is increased, but that tone is called as clasp knife rigidity, clasp knife spasticity. Clasp knife, I have told you, take a knife and try to open. Initially, you have to give force. Later on, there is no necessity. So, when I am doing flexion, I find that I have difficulty in flexing and then it goes straight. So, this is a spasticity, which is a characteristic sign of pyramidal damage. Then we come to rigidity. Rigidity में क्या होता? The tone is increased and tone is throughout the movement, and therefore it is called as cog-wheel rigidity. Now, what happens is when I am doing flexion, I am putting lot of strain, and this strain continues till total flexion is there, and this is a sustained rise in the tone, which is called as spasticity, and rigidity, which is called as rigidity. And there is one more type called as cogwheel rigidity. Now, you must have seen शेतामध्ये जे शेती आहे अशा ठिकाणी आपण मोठ लावतो. मोठ आधी तर आता इंजिन्स आलेत, पण आधी मोठ लावत होतो. त्यावेळेस ती मोठ्यामध्ये ते जो दोरा लावायचा किंवा ती हे लावायची, ती दोन प्रकारचे गोल चाक असायचं, and that त्याला वेगवेगळे दात असायचे, and that is looks like a cogwheel, and therefore it is cogwheel rigidity. How do you know clinically? Now clinically it is known because patient has tremors, and because patient has tremor, the rigidity is intermittent. So intermittent rigidity in Parkinsonism is called as cogwheel rigidity. Then we come to paratonia. Paratonia is nothing but changing the tone. When the patient is doing this movement, there is a changing tone, and the tone, when the patient relaxes, it is different, it is more, and therefore changing tone is called as paratonia. Lastly, for the purpose of graduates, I will mention that there is a progressive supranuclear palsy. Now, progressive supranuclear palsy is one condition, and second is multi-system atrophy. So, supranuclear progressive palsy, where you find that the midbrain is involved and other structures like pyramidal damage, anti-neuron cells. So many structures are involved in addition to signs of Parkinson, which is called as supranuclear palsy, not important for undergraduates. Second is multi-systematic. Multi-systematic मध्ये clear cut आहे बघा. Multi-systems in nervous system are affected. So many structures are affected, and therefore, including the Parkinsonian signs, you get a cerebral signs, you get a brainstem lesion, and if you get multiple structures involved, you call it as multi-system atrophy. The word is self-explanatory, and therefore, today, मित्रो, आपण पार्किन्सोनिझम बद्दल माहिती घेतली. I am likely to one photograph which can tell you the picture of Parkinsonism, where I will like to repeat: mask-like face, infrequent blinking, stare, tremors, which are coarse, pill rolling movement, stoop posture, and shuffling gait. And therefore, things are so clear that you make a spot diagnosis of a cases of Parkinson's disease or Parkinsonian syndrome. Thank you.